I am constantly amazed by the profound impact of sharing our struggles with each other. The one day at a time phrase helps us remember to pause. In a pulsating world, we often forget to pause. That's where One Moment Podcast began its journey, committed to nurturing mindfulness, change, and advocacy around the world, reducing stigmas associated with mental health, substance use, and suicide, and changing the way the world reacts to these taboo topics. Your voice of reason starts here. Founded by mental health professionals and agents for change, our mission is to offer insightful narratives that foster not just reflection, serenity, and insights, but to tackle the problems and solutions of mental health, substance use, and suicide on a global scale. We are making it our vision and mission to make a global impact on the mental health, substance use, and suicide crisis. It is easy to feel isolated and unheard, or like you're carrying your burdens alone. On the One Moment Podcast, we remind you that you're not alone in your struggles. There are millions of people worldwide who are struggling, and the weight of your experiences deserve to be understood. You deserve to be heard. You deserve to have a voice. The One Moment Podcast is a safe haven for connection. We have weekly podcasts. Join us to learn more about mental health, substance use, suicide, community initiatives, and much more as we tackle these global crises, creating change in the world. Change begins when we recognize there is a problem. Remember, change starts with you. Visit onemoment.chain.box to learn more about our podcast and to connect with us on social media. Don't forget to subscribe to our channels to stay up to date on our episodes. Subscribe to our YouTube channel, One Moment Podcast. If you would like to support us, you can find the links to donate directly to us on our official site, onemoment.chain.box. You can also support our sponsors. We are presently sponsored by Dubby Energy, ThePlaceTooHeal, MindfullyMeCounseling, PLLC, BrightLifeTherapy, PLLC, and Webhash. Check our official site for more information. Subscribe now. Some photos in this ad were created by Grok.
All right. Welcome, everyone, to the One Moment Podcast. My name is Kevin. I am a clinician, a licensed clinical mental health counselor here in North Carolina. I'm also a licensed clinical addiction specialist in North Carolina. I'm also a certified clinical supervisor by the Substance Use Board in North Carolina.
My name is Ruben Verdi. I'm a certified alcohol and drug counselor with over 25 plus years experience. I got my initial start in a city called Long Beach, New York, at a hospital there. Worked with some great staff. Had, of course, in this field to do some internship. I completed that in New York. Then after living in New York 40 years, I decided to move back to my home state, not my hometown, but my home state of North Carolina. So I moved to a place called Southern Pines and landed a great job in Pinehurst, North Carolina. I thought I was going to retire when I moved down here, but I couldn't retire. I'm too youthful and all that stuff, energetic and enthusiastic, so I couldn't retire. So and today I celebrate 13 years at my place of employment after leaving New York. So, they had a little party for me as well. Also, I won't keep it long. I'm also a DWI provider in the state of North Carolina. I'm also what they call a substance abuse professional. I can do assessments for the DOT and refer clients that maybe have a problem with substances. And I also got recertified to do what they call the North Carolina ADAX. That's Alcohol and Drug Education Traffic School. I can teach classes there as well. So at 68 years old, I'm a late bloomer. I should be retiring, but I'm still steadily obtaining certifications. So my next goal is to become a certified life coach. So, and that's the end. I won't take any more time. We're going to turn it over to Trevor now.
Well, good afternoon, gentlemen. I'm Trevor. I'm a former correctional professional in New Mexico and Colorado. And I am a peer. And I'm just glad to be here and part of this podcast, and look forward to being of service in the best way that I possibly can to everyone that needs assistance in any issues that they're dealing with. I'm proud to be here, and thank you, gentlemen.
We're glad to have you and Kevin, of course.
Kevin, you're muted.
Thank you. I knew that the whole time. I was making sure everybody was paying attention. Okay. Listen, I would like to, when you sent out all of the stuff to us early on, I would like to, kind of have you kind of tell us about the topic. Tell us what you were thinking about. Tell us what you were reading over, and kind of let you open the floor up, and then we'll kind of go from there and see what's going on.
Well, the understanding that I've gotten is that depending upon whatever particular situation you're dealing with, as far as gaining access to resources to help you with whatever issue you might be going to, can feel overwhelming at most of the time and frustrating, and you have to be always able to get through the barriers of whatever it is to achieve the goal that you're trying to achieve, and there's so many different things that can affect that it brought to the forefront of my mind what you actually need to try to do to be able to gain access to the resources that you need, and that can be complicated in a long sense of things.
Yeah. No, I think you're right, and I think getting access to treatment, or having access to treatment is critical, and there's so many barriers. Um, there are so many barriers to people accessing treatment, and so I'm glad that we chose this topic because it helps bring up it helps to really start that discussion off, right? Really shine light on it. Ruben, tell us what you got, buddy. Tell us what you're thinking.
I think it's a good topic because I see even with patients or clients that I deal with, their families come in and they want to get into. I work at a medication assisted treatment program. We provide methadone, buprenorphine, and and under buprenorphine, talk about Subutex and Suboxone. That's what we provide as well. So a lot of times, uh, it's a lot of bureaucracy. Patients think sometimes I think the stigma is not knowing how to access the services. Uh, I know from an addiction aspect, when you're dealing with an addiction, and you're going through withdrawal, it can be frustrating having to, one of the barriers, having to sit through an intake process and all that, and then answer all these questions. Sometimes I can even see it in the patients' faces. They get frustrated. But I tell them we have to gather certain information in order to make sure you're eligible and appropriate for treatment. And we always focus on where I work, try to streamline the intake process, but there's so many barriers, and I can, like I said again, I can see the frustration in the patients or clients' faces. One of the barriers they talk about, then I turn it over to Trevor, is talking about stigma. With addiction, and I'm sure as well mental health, there is stigma in society about addiction. A lot of people adhere to this old model we talked about in a prior episode podcast about the moral model. A lot of people just think why can't you just stop using drugs? So with mental health, they don't understand it. So there's oftentimes a stigma with those diagnoses, and that's also a barrier to getting access to help. Because people, especially in rural communities, the tight knit communities, we're opening up clinics in other parts of North Carolina as well, and I oftentimes hear patients in rural areas concerned about someone seeing them go to a clinic. So there's a stigma that has to be overcome as well for us in order to access treatment.
I understand where you're coming from on that, Mr. Rubin. And one of the biggest things is that not only are there stigmas associated with it, but there's like a stereotypical association of you seeking treatment as being grouped in with a certain type of person, depending on what you're seeking research. Seeking resources for. It can be problematic in the sense that you're being looped into a certain group of individuals that is not very successful. Sorry about that. Oh, well, what's going on here? Sorry about that. I'm having a little bit of a difficulty myself, a little barrier.
That's all part of having a podcast.
Yes. And so one of the biggest things to me is to get over those stereotypicals, we have to engage with the rest of the community to help them understand us a little bit better. And with that being said, there's a lot of communication problems that could have to be barriers, like the language, the culture, the history. So all these stereotypical and stigma things that we have to overcome just can be so overwhelming at times. You don't really know what particular direction you're going to, and be able to solve that. You have to use these resources. So you got barriers getting to the very resources you need, and you are still having difficulties. So it's a very complicated thing to get through. It could be a rural or a metro problem. It could be a male or a female problem. It could be your lack of communication. If you got a phone, if you got a computer, if you got the wheels and the gas to go somewhere. There's so many onsets of barriers that can happen to a person that it can be overwhelming to where they're like, oh, I give up. I'm not going to do nothing. And that's not a very good mindset to get into.
No, I think you're right. And before we go any further, listen, if you're into shirts, if you're into clothing at all, any type of clothing, sportswear, primarily, look, Vital Apparel has sponsored with. Come again? Vital Apparel has.
I was going to say you're breaking up.
Partnered with us to raise awareness globally as far as it goes with mental health, substance use, and suicide awareness.
In the heart of the city, a vision was born, not just a piece of clothing, but a movement. Vital Apparel reflects not just the raw edge of the streets, but the spirit of innovation to bring about change in mental health worldwide. It's more than a style, it's a statement. A blend of comfort with an attitude made for those who refuse to be average. Embrace the culture, ignite your passion, and wear the revolution. Discover your new favorite piece today and be part of something larger than life. Visit our link now at BTLapparel.com to grab your next outfit. Use promo code ONEMOMENT to get 15% off your order. Why support us? The founders of Vital Apparel, Hung Dao and Alex Kozub, sought out to raise awareness, seeking to change the stigma around mental health. 5% of their profits are donated to Brain Research Foundation, furthering the research in mental health. Vital Apparel sponsors the One Moment podcast. We partnered with one another so that together we can make a global impact on mental health, substance use, and suicide, saving lives one moment at a time around the world. Help us break the stigma. Visit onemoment.chain.box to learn more about our podcast and to connect with us on social media. Don't forget to subscribe to our channels to stay up to date on our episodes. Subscribe now. Some photos in this ad were created by Grok.
So, no, y'all, and again, Vital Apparel, check them out. Use promo code One Moment to get 15% off all of their products.
Can I show them the T-shirt?
Yeah, go ahead.
Can you see it?
Yes, that is a shirt that we just bought. It is now Rubens, called Comfortably Uncomfortable. They make their shirts pretty, bigger than average or bigger than usual. So I wear a large. I ended up getting a medium. It fits just like a large will fit me. But no, Trevor and Ruben, y'all spoke on a lot of good things. And part of the stigma of seeking treatment, whether it be for mental health, substance use, or suicidal behaviors, one of the big stigma is thought to be one of the biggest obstacles. And it's, it's a lot of what you two spoke about. Fear of being judged, fear of being discriminated against, fear of being labeled, fear of, experiencing potentially shame and, these things, is a huge barrier to seeking treatment. I was reading a article, and I know I've shared this on another episode we had a few weeks ago. But one of the articles I was reading on said something about over 20% of people don't want to share, them having some negative, dark thoughts about, unaliving oneself, to their providers, and it listed out several reasons, and one of those leads back to stigma. And so, people should feel free, regardless of the matter, to reach out for help whenever they need it. And it doesn't matter, it shouldn't matter whether it's harm reduction, whether it is a 12-step program, whether it is, the path of 100% complete, recovery off of anything, or sober off of anything. It doesn't matter whether it's psychiatric medications, non-psychiatric medications, it doesn't matter. People, that goes back into patients' rights and human rights, right? People have a right to seek treatment regardless of the circumstances, regardless of the situation. And so, yeah, I mean, for me, I think it's all about fighting stigma. And, I remember early on when we were talking about putting this whole project together, and naming it One Moment, because the goal is to have a global impact, reducing stigmas, reducing, or increasing people's, willingness, to reach out for help, and hopefully having a global impact on the field as a whole.
I was reading a statement while you were talking, and it says in the United States, approximately 40.3 million people have a substance use disorder in 2020, according to the National Center for Drug Abuse Statistics. However, more than 4 in 10 adults who need care do not get treatment. So that speaks volume. We talk about this different barriers. A lot of those barriers come from the person, their concerns, the person itself. Like a lot of times they say denial, I found, can be a barrier. A lot of times, even when I worked in an outpatient program in New York, sometimes I would get, and as well as where I work now, sometimes a family member will call in and I get the opportunity to speak to them, and they ask how can they get their loved one into treatment. when they are in denial, they don't feel they have a problem, and they ask me, well, can you call and talk to them? And I said, I'm not allowed to do that. They can contact the counselors here, and we'll be more than happy to talk to them. But denial is a barrier because that's a part. That's a part. Unfortunately, that's a part of addiction. I'm in denial. I minimize my problem. I don't think I have a problem. Uh, I seek out other people like myself. So then that behavior and that thinking becomes normalized. So my thing, if I'm hanging around people who all smoke marijuana, for example, I'm going to think, well, it's everybody smokes marijuana, which probably they don't. I heard in New York a lot of people do because it's recreational, it's legalized now. But I'm just saying, so the more I get into my addiction, the more the behavior becomes normalized. So then denial becomes entrenched, and sometimes it's hard to break that denial. And as a counselor, you don't want to. I remember working in a place when I first started an internship in New York, and it was an old school counselor, and I liked him a lot, but he was incarcerated and got out of prison, and he was a grandfather in the field. I remember uh, someone said, don't model his style. His style, he would confront the patients, and I find when someone's in denial, the more you confront them, the more resistant they become. So you want to meet that patient where they're at, and work with them. And we use a lot of different approaches to do that. One of the biggest approaches that's got a lot of attention is motivational interviewing. You want to meet the patient where they're at and try to help them transition to the stages of change from pre-contemplation. This sucks. I don't belong here. I don't have a problem. Only reason I'm coming here because my probation officer made me come to contemplation. Maybe I do have a problem. I'm beginning to think I do it. So you try to work with that patient and try to work through that denial. So denial is a barrier as well itself.
Well, Trevor, hold up real quick. I want to read this statistic off, and then I'm gonna let you pick up. But Ruben, you mentioned you started off talking about the need for access to treatment by reading off also some statistics, and you spoke about substance use only. So this one right here is mental health related, not just substance use. Well, it says based on available data in 2022, an estimated 59.3 million adults age 18 or older had any mental health illness, which represents about 23.1% of all U.S. adults. Of these, approximately 50.6%, or about 30 million, received treatment in the last year. This means that roughly 29.3 million adults with any mental illness did not receive treatment. For serious mental illness, which affected an estimated 15.4 million adults, or 6% of the U.S. Of 6% of United States adults in 2022. The treatment gap is also notable, though exact figures for untreated severe mental illness are less consistently detailed across sources. Broader trends suggest that across all mental health disorders, including any mental illness and severe mental illness, millions go without care due to barriers like stigma, cost, and access. So conservatively, 29.3 million U.S. adults with a diagnosable mental health disorder did not receive treatment in 2022, with the true number likely higher when accounting for underreported cases or those who don't seek help at all.
Yeah, that's some high numbers.
Yeah.
It sure is.
Mm-hmm.
Um,
I find even a lot of times, patients or clients, even they come into the system and wanting help, and a lot of times they don't know how to maneuver the various agencies, the various agents that provide help. at our clinic, we get a lot of funding. So a lot of our patients come in and they receive state funding through Trillium. They might receive funding from other federal different programs that's federal funded, and that helps. Even a lot of times, transportation is a barrier. Especially, I can speak where I work. We service a lot of rural communities in North Carolina, and there's not a lot of clinics or substance abuse programs in those areas, so they have to travel. Uh, when I worked in New York, transportation just wasn't a barrier. You had a lot of public transportation. I moved back to North Carolina, and where I work, literally, if you don't have a car, you have a problem. So a lot of times, I see a lot of individuals are getting licensed now and providing, getting paid through Medicaid and providing transportation to a lot of our patients. Independent carriers are getting licensed to do that. A lot of patients don't know that Medicaid can help provide services for us, transportation and all. So just breaking through those barriers and learning, and that can be a challenge, especially like I say when you're going through withdrawal and you live in a rural community, or either you're just going through addiction itself and having to work through all those challenges can be overwhelming. So I think one of the things that's important too is use of a peer specialist. A lot of clinics are using a peer specialist. They can do things with the patient that a counselor can't do for boundary reasons. They can help a patient maneuver different systems. Maybe they probably can take a patient to social services, and help them apply for Medicaid and what have you. Things that I probably wouldn't do because of boundary violations and what have you. So, because
Yeah.
that's more or less case management.
Well, I've learned a new way to work into those kind of moments, those one moments that we have to deal with. And that's called the A squared plus one, which will cube you. You be all squared away. And that is, number one, you got to figure out an approach. And it's the 3A method. We're not going to mention the other 3A thing, but it's insurance of type. You got to have the right approach of things. You have to take the how-to approach. And that can involve a lot of different how-tos. The second thing you got to do is figure out what kind of an attitude do you have to approach this. So that's the second A. How can you be in a good attitude when you're having the most difficult time of your life? What does that even involve? Who are you going to lean on to? Where are you going to get your support for help with that? Somehow you got to forge through the barrier of too much self-thinking. I mean, it doesn't mean that you can't think. It's just, you have to have a good attitude to establish your approach. And then on the last part of it, what kind of activity are you going to do? Because there has to be action involved in it. There's much action that needs to be done. You can't just sit around and rest on your rear end and just kind of mope around and think this is never going to happen, or I can't do this because of that, or can't do that because of that. This person won't do this, that person won't do that. Somehow you have to grab your bootstraps, pull them suckers up, lace them up tight, and forge ahead. Developing this cubed A method, or A squared plus one, however you want to say it, you have to have an approach. What kind of activity are you going to do? And what kind of attitude are you going to have to get through it? That helps me to get through a barrier that I might be facing, which will involve you pivoting down the path that you need to go. And
well, Kevin,
I guess I kind of keeping it simple,
Kevin
but
and Trevor, you mentioned both. Trevor mentioned attitude, but I'm a role player. If I'm coming to your clinic, I'm going through withdrawal, and I have a nasty attitude. I want help. I'm going through withdrawal because in opioid use disorder programs, when you come into a program, for example, you have to be in some level of withdrawal. So I'm going through withdrawal, and you tell me about my attitude. My attitude is going to suck. I see it all the time with patients sometimes. They come in, they're going through withdrawal, and you tell them, well, how long is it going to take? About 2 hours at least. They already got a nasty attitude. So you try to work with them. So how am I going to, you say pull your bootstraps up, but when I'm going through withdrawal and I'm feeling a sense of hopelessness, life has beat me down, it might be a challenge for me to pull my bootstraps up. And I'm not combating you. I'm just saying, how you going to help me, do that? How I'm going to develop that positive attitude? Because right now I'm feeling lousy. My probation officer is making me come here. I'm going through withdrawal. My family's turned against me. So it's hard for me to pull up my bootstraps and just, so what suggestions do you have for me? Either one of y'all.
Well, Ruben, I think, as Mr. Trev was sitting there saying it and, talking, saying what he was saying, when you said bootstrap, pull your bootstraps together and I got to take some action. Regardless of whether I'm court mandated in a facility or not, that shows me a level of willingness. When we start talking about taking action, I don't want to be there, but my willingness says I am there, right? And so I learned years ago, how you judge a person is by their level of willingness. And because they are demonstrating a level of willingness, that is also pulling themselves up by the bootstrap.
Okay.
So I don't think it's, I think when, we can hear these phrases and terms, right? But yet, that's the first thing that I thought about when Trevor was saying, pull yourselves up by the bootstrap and you have to take some action yourself. I don't know. I mean, that was my first thought process on that one.
That's now, good. Different perspectives. I wasn't challenging Trevor. I just wanted to.
No, I don't think you were, but I think it's about, I think it's, I want to make sure that there's a level of understanding there because some people can say, oh my God, I don't, whatever their reaction is, right? I don't know. I'm not even going to pretend whatever anybody's reaction is. But when you look at what Trevor was saying, though, like that's what he was talking about, pulling, I have to do something.
Imagine a day where fatigue doesn't stand a chance, where clarity perks up your focus as the clock ticks on. Discover Dubby Energy, the drink that transforms ordinary moments into opportunities. With no sugar and flavors that feel like gourmet art, each sip stirs your senses, readying you for greatness. Dubby Energy is a focus energy drink that contains no sugar and is available in a variety of unique flavors. Their coffee fruit cherry extract is the star of the show. This ingredient is what makes Dubby unique and helps to provide smooth and effective focus and energy, making it perfect for anyone who needs to conquer a task. Dubby flavors are created with one goal in mind, to taste unlike any other beverage. We combine bold and unique flavor combinations to craft an experience for your tongue with each sip. Dubby achieves its smooth, effective focus with a high-end tasting experience while using no sugar, no fillers, and no artificial color or dyes. Every product they create follows the same philosophy. Be effective, be clean, and taste as good as nature will allow. Use promo code ONEMOMENT to enjoy 10% off their products. And most importantly, they sponsor the One Moment podcast. They are helping to raise awareness of mental health, substance use, suicide, and much more around the world, seeking to make a global impact, reducing stigmas and changing lives one moment at a time. Visit onemoment.chain.box to learn more about our podcast. Follow us on our social media channels for more information and to stay up to date with our episodes.
Imagine a battle raging inside you, a battle between two wolves. One embodies all that is good, the other all that is evil. Vladimir Soloviev, a renowned Russian philosopher, once said, "What is important is not that in every man are the roots of good and evil, but which of the two prevails." This idea is beautifully captured in the Cherokee proverb about two wolves. When asked which wolf wins, the wise grandfather replied, "The one you feed." In our daily lives, we often feel pulled in various directions, experiencing internal conflicts and questioning our choices. These ideologies remind us to focus on doing what's right, to feed the good wolf within us. Feeding the good wolf means nurturing qualities like love, honesty, honor, integrity, respect, dignity, loyalty, and trust. Every day presents a new challenge. Which wolf will you feed today? Tomorrow? Next week? Next year? The choice is yours, and it shapes who you become. Will you let the good wolf prevail? Remember, the wolf you feed determines the path you walk and the person you grow into. So, as you close your eyes tonight, ask yourself, which wolf will you feed? Good night, family. KO.
I am constantly amazed by the profound impact of sharing our struggles with each other. The one day at a time phrase helps us remember to pause. In a pulsating world, we often forget to pause. That's where One Moment Podcast began its journey, committed to nurturing mindfulness, change, and advocacy around the world, reducing stigmas associated with mental health, substance use, and suicide, and changing the way the world reacts to these taboo topics. Your voice of reason starts here. Founded by mental health professionals and agents for change, our mission is to offer insightful narratives that foster not just reflection, serenity, and insights, but to tackle the problems and solutions of mental health, substance use, and suicide on a global scale. We are making it our vision and mission to make a global impact on the mental health, substance use, and suicide crisis. It is easy to feel isolated and unheard, or like you're carrying your burdens alone. On the One Moment Podcast, we remind you that you're not alone in your struggles. There are millions of people worldwide who are struggling, and the weight of your experiences deserve to be understood. You deserve to be heard. You deserve to have a voice. The One Moment Podcast is a safe haven for connection. We have weekly podcasts. Join us to learn more about mental health, substance use, suicide, community initiatives, and much more as we tackle these global crises, creating change in the world. Change begins when we recognize there is a problem. Remember, change starts with you. Visit onemoment.chain.box to learn more about our podcast and to connect with us on social media. Don't forget to subscribe to our channels to stay up to date on our episodes. Subscribe to our YouTube channel, One Moment Podcast. If you would like to support us, you can find the links to donate directly to us on our official site, onemoment.chain.box. You can also support our sponsors. We are presently sponsored by Dubby Energy, ThePlaceTooHeal, MindfullyMeCounseling, PLLC, BrightLifeTherapy, PLLC, and Webhash. Check our official site for more information. Subscribe now. Some photos in this ad were created by Grok.
Have you ever wondered how the principles of 12-step programs align with the core values of diversity, equity, and inclusion? Stay tuned to discover a surprising connection that might just change your perspective. Good morning, family. Today, we delve into the 12 traditions of 12-step programs and their emphasis on relationships. How do these traditions mirror DEI principles? Diversity is about our differences, and inclusion ensures everyone feels a sense of belonging. The 12 traditions guide us in respecting both differences and similarities. These traditions allow individuals to be themselves, free from barriers, and participate fully in relationships. They foster a sense of belonging, freedom, and love. People often say, the steps keep me from killing myself, and the traditions keep me from killing other people. This highlights the importance of these guidelines in maintaining harmony. Many religious ideologies also emphasize DEI principles. For instance, Judaism's Tikkun Olam focuses on community service and social justice, aiming to repair the world. Jainism, an ancient Indian religion, emphasizes compassion and empathy, recognizing the inherent value and dignity of everyone. The Lotus Sutra, a Buddhist scripture, teaches us to recognize the worth and dignity of every individual, reinforcing the idea of inclusion. Feeling a sense of belonging is crucial for our growth and development. It's inherent in our very fabric of existence as social beings. So, what will you do today to help someone else feel a sense of belonging? Let's continue to pass on love, compassion, and empathy to everyone we meet. Peace and love to all.
Right.
Even if I'm court mandated, I'm showing up because it's my willingness to abide by the court, right? I am having a level of willingness to show up. Now, with that being said, when we look at the barriers to treatment, it says, there's another barrier to treatment is cost and insurance issues. treatment can be somewhat expensive, especially if you're talking about $15 a dose, or if you're in if you're in any type of opioid treatment program. If you're having to go to a hospital, to seek treatment, on an inpatient stay, you're talking about thousands of dollars a day. On a residential program, they range from, 2,500, 3,000 to, $60,000, $80,000, and Medicaid doesn't pay, for those $80,000, treatment programs. Not that I know of. I might be wrong on that one, so don't quote me on my deal there. And then if you're using private insurance, high out-of-pocket costs, or maybe there's a high deductible. Maybe you got to pay $10,000, $15,000 down just before your insurance will kick in and pay the rest of it. Now, on top of that, when we talk about the cost and insurance problems there, right? Some of those barriers, we also need to talk about, I know we were talking about this the other night, gentlemen, and I just want to kind of reiterate this is, you're talking about pay for the employees who's doing the work, right? There's also adequate pay. I can Google right now, what the average pay is for a licensed substance use counselor, and it's going to be rather, devastating. It's going to be sad. Like, it makes me cringe on the inside when I see those things. And so when you have that inadequate pay, the inability, and I'm not going to say it's the insurance fault, and I'm not saying it's the employer's fault. I'm not going to cross that line right there, because that's a whole nother piece to it, right? But when you can't afford your therapist, or you can't afford your employees, there's high turnover rate. And so that also goes back into lack of access to services. That also goes back into increased stigma issues, right? I was interviewing for a job once, and Trevor, I see two of you, brother. But I was interviewing for a job once.
Who is better?
Right? No, 100%. So, but and this was about a year, I don't know, about 3 years ago now. And I'm not going to name the agency just because I don't want to get sued or anything like that. And, but they were looking for a licensed counselor, clinical, addiction specialist. They were also seeking a fully licensed mental health counselor, and they were also seeking a certified clinical supervisor for 40 hours a week. Okay, for 40 hours a week. Now, in that interview, they were telling me, all about the job, and I'm like, man, that's, I can do it. It's not an issue at all. And then they hit me with, they could only pay me $48,000 a year. That's not the catch. They also said that I had to sign a non-compete agreement or non-compete clause, and I couldn't work for another entity anywhere doing the same thing or similar things. And I said, well, that was kind of, devastating for me, right? And I'm like, well, and so I asked him right there in the interview, I said, well, how the hell am I supposed to feed my family? Right? Like, I was straight with them. I asked them that, right? And they got mad at me. They got really mad at me in the middle of an interview. And I don't care. Listen, I don't care if an employer wants to get mad, because, no, listen, I have a family I have to feed, right? Or you have a family that you have to feed, or whatever, right? If I'm gonna come to work for your agency, you should be willing to pay me. We have people going to school for 5 or 6 years, and you're trying to pay them pennies, right? You're trying to pay them pennies. And so that increases, or decreases access to treatment for a lot of people, because you can't, literally, you have no staff working for you, or don't have the adequate amount of staff working for you. Right. So this is for any employer who's going to be watching this. And I hope when I do the editing, this comes up. Pay your employees. Keep your employees. Okay? Pay your employees, folks. All right. You need to be able to provide adequate qualitative services to the community. Pay your employees a decent amount. You don't have to overpay them, but don't underpay them. Don't steal from your employees. Take care of your employees and they will take care of you. I'll say it again.
Find that,
take care of your employees and they will take care of you.
yes.
Well, go ahead.
I find, like, even before I moved back to North Carolina, that was a concern because I had to Google, and I knew that, for example, like the cost of living in New York compared to North Carolina. So I had to Google like, and they had a comparison scale what I was making in New York, and they had that same similar lifestyle, how much I would need to make, and I was prepared for that when I moved to North Carolina. I knew that I wasn't going to make, and when I had the job interview, she told me I wasn't going to make the money that I made in New York. But, because I had experience, I was certified, I had experience, I was able to negotiate. And I think sometimes to come back, what you're talking about, you said pay your employers. I think when you first start off on the entry level, sometimes you might have to accept that amount of money. You might disagree, but I think over time, like when you gain skills and like you said, there's a difference. You're licensed, I'm certified, but I found that just for me, I can only speak for myself. I think when an employer values your skills, they are willing. You can sort of negotiate, and I was able to do that, and they are willing to pay you. You negotiate a price, hourly wage, or whatever. And I think the employer that I work for are good about doing that. If you really feel like I said, I went for training to do a DWI. I took a training so I can become a DWI provider. I took training to so I can work for the Department of Motor Vehicle, do assessments for them. I took training so I can do assessments for the DOT. So there are a lot of things that you have to explore that you can do, whether you're certified or licensed. There are things you can do. And I think a lot of times I say to young people coming out of school, my granddaughter, she just completed her master's and she's going to follow in the footsteps. She's becoming a licensed mental health counselor in Maryland. And she knows that in the beginning she might have to accept that, but that pay. But as over time, I'm not saying minimize her skill, but as she gains skill sets, you can oftentimes negotiate with an employer. Now, I know you're going to disagree, so go right ahead.
Now, I'm gonna give you some pushback on that. So I was mentoring a graduate student who has worked in the field for about 4 years at that time, and he was about 2 months away from getting his license. And his employer looked at him, and I know the employer. I know, I got respect for the employer, and I know the guy. And I mean, much respect for the guy. And so when he was getting his license, his employer said, well, listen, once you get your license, we're going to give you $20 and some 20. I think it was $20.50 an hour. Okay, $20.50 an hour, right? And he was like, Kev, they told me that this was average pay for entry level clinician, and I'm like, well, dude, you're not entry level. You've been in the field for 40 years. You know your ethics, like you've been doing this for a hot minute, right? And so then I asked him, like, are they talking about local average, state average, or national average? $20.50 to start off. I'm sorry, but I can go to Chick-fil-A, Sheetz, McDonald's, right, and make a whole lot more than 20 an hour.
No, you can't.
Yeah, Ruben, do not argue with me on this because I will pull it up in a heartbeat. Okay. I was literally working for an employer and they wanted to drop me $50,000 a year. I would have been making less than an employee at McDonald's. Okay. And this was as a professional, So yeah, when it comes to pay for, people, employers need to get better on that. get significantly better. They need to take care of their employees if they want to stay in business and if they want to provide quality services. That's all I'm saying.
Okay.
Imagine a day where fatigue doesn't stand a chance, where clarity perks up your focus as the clock ticks on. Discover Dubby Energy, the drink that transforms ordinary moments into opportunities. With no sugar and flavors that feel like gourmet art, each sip stirs your senses, readying you for greatness. Dubby Energy is a focus energy drink that contains no sugar and is available in a variety of unique flavors. Their coffee fruit cherry extract is the star of the show. This ingredient is what makes Dubby unique and helps to provide smooth and effective focus and energy, making it perfect for anyone who needs to conquer a task. Dubby flavors are created with one goal in mind: to taste unlike any other beverage. We combine bold and unique flavor combinations to craft an experience for your tongue with each sip. Dubby achieves its smooth, effective focus with a high-end tasting experience while using no sugar, no fillers, and no artificial color or dyes. Every product they create follows the same philosophy: be effective, be clean, and taste as good as nature will allow. Use promo code ONEMOMENT to enjoy 10% off their products. And most importantly, they sponsor the One Moment podcast. They are helping to raise awareness of mental health, substance use, suicide, and much more around the world, seeking to make a global impact, reducing stigmas and changing lives one moment at a time. Visit onemoment.chain.box to learn more about our podcast. Follow us on our social media channels for more information and to stay up to date with our episodes.
So what are some other barriers? And then we got to start working on some solutions. We don't want to just talk about barriers throughout. There are barriers, but what are some other barriers?
Well, that's true. So you have lack of awareness or knowledge. I think a lot of people don't understand. I think your screen is frozen up.
Mine?
Yes, sir. I think it is frozen up. So, you have lack of awareness or knowledge. You also have cultural or language barriers.
Mm-hmm.
One of the things that I have found for myself working in the field, it's hard to provide treatment, to somebody who is of a different culture than I am, who speaks differently than I am. I remember I was doing a session with a patient, who was spoke a different language and everything. And one of the things that I struggled with was between English to their language. It was very, it was all, what phrase do I want to use? It was like there was no direct interpretation or translation from English to their language, and so that presents to be a barrier because when you're asking them, I don't know, for an example, any type of trauma, right? Like, have you ever experienced any trauma? They might come up and give you a different answer than what you traditionally would be, are seeking, right? And to them, it might be that, but when you interpret it from your training, right, and from your culture, you're going to interpret that completely different than the way they're actually meaning. And so, language and culture barriers is a huge problem, in the field, and it prevents, or it increases, it creates that environment for lack of access to treatment, to adequate treatment.
Do you think you have to be of the same culture of that person or race to make that impact?
No, I don't. I was working with an African American guy once, and he was telling me he's got a rap sheet. I mean, he's got a rap sheet, thicker than this computer closed. Okay, I mean, it's he was my age, and I'm in the middle of a session with him, and he's telling me that he's not getting any jobs at all. He's not getting any callbacks, anything, and so we're exploring a lot of different things. And of course, I'm working in a substance use treatment facility, and so for those of you who think that if you're a substance use counselor and cannot work in the career counseling department, I'm sorry, you are absolutely 100% wrong. You can work within individuals' career domain. as it relates to substance use treatment and to their substance use or to their, drug use or what have you. So I'm in a substance use treatment setting, and he's telling me about his barriers in his, trying to get employment. And so exploring with him, I'm like, well, man, like, I don't know. I just had this thought come up. I'm like, well, how are you filling out your applications, your resume? He was like, filling out this, I'm doing this, and asked me if I got a criminal record. I'm just trying to be rigorous, honest. And I'm like, what are you putting on your criminal? What are you writing down? He told me everything that he was writing down. He was writing his whole book down, and he was like, and I'm not getting nowhere. I don't want to lie to him. I'm like, well, have you ever thought about putting in that one simple spot, will explain the interview? He said, no, I never thought about that. He was like, nobody's ever said that. I said, will explain the interview.
Oh.
So he said, no, I never tried that. And I said, well, how about this? My encouragement is go home, start doing it today, make it a practice, right? And so I questioned him. I said, you're already a black person, right? A black male, which is highly stigmatized. I said, and so you're shooting yourself in the foot. One, because you're black, not, I said, through no fault of your own. I said, you're African American. That's one shot in the foot. I said, you're a male. That's the second shot in the foot. Why shoot yourself a third time in the foot when you don't have to, right? I said, that part you can control. And it was funny because about a week or two later, he met with me. He was like, Kev, I got all these interviews lined up, right? I got all these interviews lined up. That was key. That was key. So, the guy listened to me. I gave him encouragement. He didn't know. Nobody's ever said that to him before. No other counselor. No other therapist, no other place that he's been to said anything to him like that before. And his whole life changed just like that, just because he quit putting his rap sheet down. He was getting those interviews, showing up and talking.
Having a felony convictions can be a barrier. But I know and I'm not the most technically savvy individual, but I use a lot of Google, and I remember patients. We had a group for a vocational group where I work, and a lot of patients talk about I can't get a job because I have a felony conviction, and we Googled a list, and we contacted those employers, and we asked them, could we put them on a list? And there's quite a few employers that will employ somebody with a conviction. So it's not that hopeless as one might think. There's quite a few employees that would do that. So that's, I think to remove those barriers, and it's not going to happen overnight. You have to educate yourself. You have to, I know for example, where I work years ago, we don't no longer do that right now. We started a harm reduction, a needle exchange program. And so, some people in the community probably were against that. They were afraid that it would bring what they would consider undesirables in the community and what have you.
Mm-hmm.
And it would bring people who are drug dependent or I use the word have addiction. And we said, in Pinehurst, it might be like an affluent community, but they're already there. So you already have that. So we found that what we had to do is go and meet with the police department and the sheriff department and talk to them and have open communication. And over time, it was a process. They welcomed that exchange program because they knew that we're not encouraging drug use, but we're saying we're going to help. When a person comes to exchange needles, we don't just give and say goodbye, give them needles, say goodbye. We introduce them. We give them education about harm reduction. We provide them a packet with different items in there, so they get educated as well. They come in contact with the staff, and they see that, wow, maybe this is a place I want to be. So you can introduce them to treatment through like harm reduction. So I think you have to educate the community, and that is a challenge, and it can be enduring, if you want to use that word, to educate the community. But that's important to go amongst your politicians and and talk about it. And we do that all the time. We do outreach to the communities and what have you. And like I say, to have a medication-assisted treatment program in Pinehurst, when I first applied for the job, because I always heard Pinehurst, I thought about golf, like the U.S. Open, it is a affluent area. And I was shocked when I came for the interview, from New York, saying, oh, they actually have a medication-assisted treatment program, and I couldn't believe it. And it's the neighbors, they accept it and all. We have good communication with the hospital. There's a hospital right nearby. We communicate with the doctors. We get a lot of referrals because over time we engage with those entities and we educate them. So we get a lot of referrals. I go to the hospital every morning for breakfast, and over time, just one-on-one, some of the employees get to know me over time. They say, where you work, Ruben? I tell them. And I think over 10, 12, 13 years, I've seen that attitude change. Like, you do a great service for the community. I'm glad your clinic is there helping us. So I think you have to educate and help break those barriers and the stigma. And that's take patience as well.
Nah, everything you said was right, and I think that goes back into another barrier that you were actually talking about was systemic issues, right? And there's more than just those systemic issues that you were addressing, right? Because you're talking about business and community relations, right? Between educating the public, educating law enforcement, meeting and having those, critical meetings and building those critical relationships up, right? That's the infrastructural pieces that are missing in the field for a good portion of mental health and substance use providers. And other systematic issues is bureaucratic hurdles, long wait times. There's many places that they are 3, 4, 5, 6, 10 months out. And that's not just mental health and substance use. That is also medical problems, right? Or medical, some of those medical clinics. You also have complex healthcare systems that can create additional challenges. So having to jump through all this red tape just to get an appointment, that's insane. That is insane. And you have, problems with the referral processes. It is just so many of these systemic barriers creates problems. It's literally increases lack of access to healthcare. Yeah. You spoke on transportation earlier, and that's another systemic barrier, right? Or systematic barrier, either or. And I want to kind of, wrap this up on the last part too.
I want to hear from too as well.
I don't know, Trevor, are you here? I don't think he's here.
Okay.
And so you have co-occurring disorders. And part of the some of the research shows that individuals with both mental health and substance use disorders face compounded challenges as treatment for one condition can be complicated by the other. And then part of that also kind of adding into that, you have a lot of facilities or clinics or agencies that only focus on one or the other and not have that integrated care where they're mental health and substance use both, right? Where they can treat both a mental health and substance use disorder. That's another, again, lack of access to care, right? That's part of those infrastructural problems or issues. And, I know there's a lot nowadays, and Trevor, I wish he would actually be able to get on and talk about this, as it looks like he might be having some issues, but he was reading about, changes in the mental health and substance use field that has been being pushed over the last couple of years, especially here in North Carolina, where you have, integrated behavioral health and primary care, where you have these primary care facilities, right? Like your doctor, my doctor, they're being approved to provide behavioral health services, right? And they're hiring substance use therapists, they're hiring mental health therapists, social workers, stuff like that, and bringing them into their field, and bringing them into their facility so that, when they're there for their, for their primary care, if they need to check in with their social worker, their
Sure.
therapist, maybe they're having suicidal ideations, at least they have that type of mental health, treatment there, taking care of those systematic barriers or those system, or increasing access to care, during those times.
Does anyone else have that one moment where everything feels too overwhelming to handle? Fortunately, there are therapeutic resources where you will learn the skills necessary to bring clarity and focus amidst chaos, making everything feel manageable again. At MindfullyMeCounseling, we guide you towards clarity and calm with personalized therapy. Embrace your self-care today. Visit MindfullyMeCounselingPLC.com to learn more. We sponsor the One Moment podcast. They meet weekly to discuss critical topics related to mental health, raising awareness on various topics such as substance use, suicide, trauma, family, and more. Visit onemoment.chain.box to learn more about the podcast and to be connected to additional resources. Subscribe to their social media channels for more information.
Good point. I think, like I said, people out there who are want to get into treatment, who haven't substance use disorders or mental health concerns, don't give up. I just say, just don't give up. There are programs out there. There are challenges, but I think what it is, we come to our clinic, we have counselors are willing to help. Sometimes we can't do the legwork and take a person to social services, but we can hook them up with a peer specialist. We can help them navigate the system. So I just say, be patient. Things are changing for us, mental health, and the stigma. I think it has gotten better. Look at how it was 100 years ago when they were doing lobotomies, and stuff like that. We've come a long way. We definitely have. Even in substance use disorder treatment. Look, medication-assisted treatment is considered the gold star of treatment for us, opioid use disorder. And I think people are opening up to that, whereas they used to think, oh, you just put them on another drug. I think families are becoming more aware. Where I work, we have over 500 patients, and that's because people are opening up to that. And if you could provide integrated treatment, like you said, we're not a mental health clinic, but we can refer them, and hopefully they will get treatment and treat those both co-occurring disorders, and not just segment them, but treat them both. So just be patient out there, And again, what I was saying with this podcast, I always tell Kevin, I'm not an expert in this or that. I'm a substance use counselor with 25 years experience, and I have some expertise in that. I'm still learning and growing, but I said I'm not an expert in anything. But I think that's the beauty of having a podcast. We don't claim to be experts. We're just providing information. We're engaging in conversation that might help you, might motivate you to seek treatment. So don't look at us. We're not providing some medical expertise or whatever. We're just three guys that's, that cares, starting the conversation, and hope you continue to join us. Definitely.
No, you're right. Look, there's more than just these barriers that we spoke about. I mean, we can keep the barrier conversation going on for another 2, 3, 4 hours, getting so far into weeds with it. And for me, I think it just goes back. I think it really just boils down to the simple idea of fighting for change, right? Advocating for yourself. And that's just not just for patients, but also employees. I mean, it's one of those things, man. Like, there's so many barriers, but I believe that barriers can be broken and are meant to be broken.
Yes.
Just like we, there for a while, there was lack of transportation problems, right?
Mm-hmm.
But then people fought for policy changes. People fought for this change and that change, and we've got increased access to treatment, right? There's still work to be done. People, there for a while in a lot of states, addictions counselors, licensed clinical addiction counselors could not, treat mental health or diagnose mental health, right? In a lot of your states now, that law has changed. They allow substance use counselors to be able to treat and or diagnose a mental health disorder as long as there's a substance use disorder, or depending on how that law is written up. I know here in North Carolina, it allows us to be able to diagnose a mental health disorder. And in the event that our diagnosis says that there's only a mental health and not a substance use disorder, we have to refer out to a mental health provider.
Okay.
And again, every state's different, but there's many states that are similar to North Carolina's laws and policies and regulations. So there's always going to be changes, whether it's on the patient level or whether it's in the bureaucracy of the field. And so don't give up that fight just because something didn't happen or because this barrier is here. There's always solutions. There's always, there's always room for improvement. There's always need for change. And I'm sure Ruben can speak on things that he's saw, as far as from his experiences in the field. So.
Okay.
Any
Other day,
questions,
somebody
comments,
asked
or
me,
concerns?
this is on a less serious note. I think podcasts can be, we can have some fun too. Somebody asked me, Ruben, when you do these videos, are you asleep? I said, why you acting this? Your eyes like they close all the time. I said, you know what it is? When you get older, when you start off young, your eyes are really big. As you get older, that extra skin starts to close as you get older. And I find that it looks like I'm asleep all the time when I'm not. I used to look at my grandpa, and everybody I said, wow, I'm looking just like my grandpa wrong. My eyes are getting tinier and tinier as I age, and I'm like, but I'm not asleep.
Ruben, oh my God, Lord have mercy. Listen, I know I didn't play many, we didn't play many of the advertisements, but they will be in the final edit of the video. So I want to take us out to one of our last or to one of our ads. This will be one of the last ads that we play. Let me see if this one's it. So listen, folks.
Have you ever felt like the world would be better off without you? You're not alone, and there's more to this feeling than you might think. New research reveals that suicidal thoughts and behaviors are unique to each individual, challenging the old belief that it's solely due to depression. When people are suicidal, they often believe they are a burden and that their absence would relieve others. They might see suicide as a solution to their overwhelming problems, feeling lost and unloved. But ancient wisdom, like that from the Bhagavad Gita, teaches us to give up selfishness and embrace kindness, respect, and compassion for all. St. Paul once said, "Love never fails," reminding us of the enduring power of love in our lives. No matter where you are in your struggles, remember that someone cares about you, trusts you, and loves you. You are not a burden. Time has a way of healing, and your struggles will pass. Don't give up before the miracle happens. Hold on, because peace and love are within reach. If you need immediate help, please contact local emergency services. Peace and love to all. KO.
Does anyone else have that one tool that makes building a website a breeze? In an era driven by digital change, Webhash is the indispensable tool that holds the key to effortless website creation. Create websites that endure, defy censorship, and bypass any single point of failure. As cutting-edge technology redefines reality, seize the power to build beyond limits. Join the Web3 revolution now and forge paths others can only dream of. Visit our site today and build your legacy. Building my own space on the web was always a grind until I hit up Webhash. Their no-code builder is my ace. It's swift and solid. It's like rocking a digital fortress that's immune to the typical shutdowns. Level up your web presence without stress. Ready to stake your claim in the digital realm? Dive into Webhash today, connect your Web3 wallet, and get started. They have multiple subscription plans, from a free version to a lifetime subscription. Check them out today at webhash.com. Most importantly, they sponsor the One Moment podcast, helping to raise awareness to critical topics in the healthcare field. Our official website was built using the Webhash platform. Throughout the projects that the One Moment movement built on Webhash, they stood behind and supported it all the way. Sign up and start building your website today. Don't forget to visit onemoment.chain.box and subscribe to our social media channels.
Have you ever felt unstoppable, like nothing could stand in your way? Sia's powerful lyrics in Unstoppable and reflections from Narcotics Anonymous's Just for Today inspire us to explore the choices we face in life. Nobody chooses their struggles with mental health or substance use, yet our decisions shape our paths. It's a journey filled with challenges, but also with opportunities for strength and resilience. Recovery is not just about overcoming obstacles, it's about making choices that reflect our inner power and determination. Imagine the impact of your decisions, not just on your life, but on those around you who are battling their own challenges. Every choice we make can either build us up or break us down. What will you choose today? Reflect on the power of your decisions. Each one is a step towards becoming unstoppable. Think about the people who look up to you. Your choices can inspire them to find their own strength. In moments of doubt, remember that resilience is built one decision at a time. Choose to be strong. Take a moment to reflect. What choice will you make today? Will it be one that showcases your unstoppable spirit? Peace and love to all. Remember, your choices define your journey. Stay unstoppable.
In the heart of the city, a vision was born, not just a piece of clothing, but a movement. Vital Apparel reflects not just the raw edge of the streets, but the spirit of innovation to bring about change in mental health worldwide. It's more than a style, it's a statement, a blend of comfort with an attitude made for those who refuse to be average. Embrace the culture, ignite your passion, and wear the revolution. Discover your new favorite piece today and be part of something larger than life. Visit our link now at btlapparel.com to grab your next outfit. Use promo code ONEMOMENT to get 15% off your order. Why support us? The founders of Vital Apparel, Hung Dao and Alex Kozub, sought out to raise awareness, seeking to change the stigma around mental health. 5% of their profits are donated to Brain Research Foundation, furthering the research in mental health. Vital Apparel sponsors the One Moment podcast. We partnered with one another so that together we can make a global impact on mental health, substance use, and suicide, saving lives one moment at a time around the world. Help us break the stigma. Visit onemoment.chain.box to learn more about our podcast and to connect with us on social media. Don't forget to subscribe to our channels to stay up to date on our episodes. Subscribe now. Some photos in this ad were created by Grok.
All right, listen. We cannot leave out of here without giving credit where credit's due. We have several sponsors, and I think for today, the last sponsor that we're going to be advertising is going to be the one and only Ruben. Guess who?
Sierra Soros.
Tell us about it before we be. I'm gonna let you close it out with that, and we're gonna play that ad, then we're done.
Well, Sierra started, her and another colleague started their own private practice in Sanford, and they have a few others throughout North Carolina. I think one in Laurinburg as well. And it's called ThePlaceTooHeal. They provide therapy, substance abuse counseling, harm reduction approaches. I mean, an array of different therapeutic approaches and services. They're involved in helping the community, giving back to community. I think, for example, I think women could come to this program, for example, and get various products they might need, like hygiene products and what have you. So I think I can just speak from knowing her over the years. She was our clinical manager for a while, and I learned a lot from her. And after she left there, I continued to maintain a relationship with her and another young lady named Taj, and they're both doing great. And I just say, you have to come and just check out the Place to Heal in Sanford, North Carolina, 715 North Horner Boulevard. It's a great facility. At some point, we want to do, when they're ready, do an open house and have a live podcast and interviewing and just bringing to the forefront what they really do. They do so many things that I can't just begin to list them all.
No. No, you're right. And so we're going to take it out with that ad, and then also give a huge shout out and a huge thank you to MindfullyMeCounseling and BrightLifeTherapy out of the state of Texas, and Dubby Energy. They are also foundational to what we do. So, but as always, listen, we're going to be doing podcast Wednesdays and Fridays. Hope you enjoyed today, because we got plenty of discussion and plenty of advocating and fighting to do, and plenty of change to go to push forward. So, as always, family, good evening, good night, and good morning to whomever will be watching this video, and wherever you might be.
Feeling lost
We
or
appreciate
alone,
you.
struggling with unbearable trauma or addiction. Every day feels heavier than the day before. The weight of unaddressed emotions and problems can leave you paralyzed. On the One Moment podcast, we are aligned with the vision and mission of ThePlaceTooHeal. Founded in Sanford, North Carolina, ThePlaceTooHeal is a growing multi-specialty mental health and substance use practice dedicated to facilitating healing and personal development. Our team of compassionate clinicians are committed to providing evidence-based therapeutic interventions tailored to each individual's unique journey. We are passionate about empowering our clients to overcome challenges and achieve emotional wellness. ThePlaceTooHeal hosts and sponsors the One Moment podcast. Visit onemoment.chain.box to learn more about our podcast and to be connected to ThePlaceTooHeal. Follow us on social media for more content,